Welcome to Faith and Freedom. For the next few minutes, we hope to inform, inspire, and encourage you as we discuss legal victories and challenges to your fundamental freedom and religious liberties. Faith and Freedom comes to you from Liberty Counsel, a civil liberties education and legal defense organization. Join us now as Matt Staver, founder and chairman of Liberty Counsel, explains the latest legal issues all across this country. In the courtrooms of America, Liberty Counsel is winning the battle for your constitutional freedom.
ObamaCare will push health care premiums through the roof. Hi, I'm Matt Staver, founder and chairman of Liberty Counsel. Joining me is Shawn Akers, the vice president of Middle Eastern Affairs for Liberty Counsel. We have been involved at Liberty Counsel in litigating against the Obamacare since the very first day it was signed into law by President Obama in 2010. In fact, in mid-May, I'll argue the case at the Court of Appeals for the second time, and the case may well go back to the U.S. Supreme Court. We can talk about some of the details on this, but one of the problems that we've had with Obamacare is not only it's a threat to life and liberty, but it also, we've said from the very beginning, is going to make health care costs more expensive and decrease the quality of health care. So it's doing exactly the opposite of what it's purported or marketed to do. And now the Secretary of Sebelius, the Secretary of HHS, Kathleen Sebelius, commented on some of these skyrocketing costs, and the Society of Actuaries actually sent out some information talking about the increased premiums that Obamacare will ultimately require.
You know, Matt, it's important to understand the depth of Obamacare, that it has as much to do as a socializing function and a redistribution of wealth as it does with anything else that it's purported to have to do with. The facts are coming out now, and what many predicted, including Liberty Counsel, are showing to be absolutely true, that this thing is raising cost already. It's not even fully implemented yet, but it's already impacting the pocketbooks of everyday citizens, and it's only going to get worse.
Well, the Society of Actuaries predicted an average of 32% increase in the cost of claims paid out by insurance companies, thanks to the new regulations requiring them to cover people with pre-existing conditions. Now, covering pre-existing conditions sounds good, and certainly we want to be able to have pre-existing conditions covered. But if you do that, the problem that you have is you ultimately increase the cost of insurance. Insurance companies, they do calculated risk based upon their exposure. And if they have to cover any and all comers, then that means that they have to increase the cost of the premiums, meaning everyone will pay a much higher cost. And instead of having specific tailored kind of insurance for that particular individual, Obamacare puts this blanket across, whether you need this particular coverage or not, you're going to get it. And so that also increases the coverage cost. Everything increases coverage costs. Who's ultimately going to pay? The insurance companies are not going to eat the cost. They're going to pass it on to the employers, and the employers are going to ultimately end up covering that cost, and the employees are going to end up covering that cost. And eventually, there's just not enough money to cover it. So employers won't be able to hire as many people, and the economy will also be affected as well. So this is a nightmare that's coming down the pipeline. Yeah,
Matt, an analogy can help understand really how that's working. Like you said, from a political standpoint, it sounds very compassionate to include pre-existing conditions, and we all want everyone who's suffering to have access to medicine and medical care. We all hunger for that. But let's take it out of that context and say that there was new mandates with auto insurance, that everyone, not only who may have a wreck, but everyone who's already had an accident is now automatically covered, but we're all going to pay the same rates. What we've done there is said that everyone in the whole pool is going to pay for what we already know is 100% certainty in pre-existing accidents. And it's a way of transferring the debt of one to another. Now, what that does on the national level, like you pointed out in more than one way, by causing you to purchase insurance for things that you don't need it for and to participate in places that you don't fit the description, it's a way for the federal government to redistribute wealth from one group to another. Now, anytime that you see that happen, people like Frederic Bastiat would say that it's plunder, that it's something the government not only is not authorized to do, but it's in direct violation of the laws of nature and nature's God and those inalienable rights to life, liberty, and the pursuit of happiness. And sometimes that was referred to as property.
Well, I know a physician in Central Florida, a Latino physician, probably in his 50s. He no longer practices medicine. He left the practice of medicine because of this Obamacare. The Orlando Regional Medical Center, very large facility in Central Florida, had the largest layoff in its 100-plus year history. Why? Because of Obamacare. Now, this is a medical facility that's actually providing medical care in a area of Central Florida that has several million people. They've laid off people. They've laid off their health care providers. I've talked to other health care providers as well, and their doctor offices are laying off people. You think, well, this should be a big boon for the health care providers. It's not a big boon for many of the actual people that are providing the health care. Many of the doctors are leaving their private practice and they're now affiliating with hospitals because they don't want to deal with all the bureaucratic, nightmarish paperwork that this will require. They'll just become paper pushers, and they'll have to hire staffs, load up their staff with just people that process Obamacare regulation papers. There's over 20,000 pages already of regulation for Obamacare, and it hasn't even been fully implemented.
Matt, medicine is like anything else. If you're going to put yourself through a tremendous amount of work and labor and dedicate a tremendous amount of your life to a particular thing, you're doing that because you expect something at the end of that work that justifies it. These doctors go to school for many, many years to do this. They sacrifice a lot to become doctors. But if we make it economically not beneficial to them, if at the end of that they could have made more money by doing something that involved a lot less of their time, talents, and risk, then they're not going to do it. So what you see is lowering numbers of doctors that are willing to take that kind of risk, put up with that kind of paperwork, and make less money for their investment. And it hurts everybody in the end.
Well, it does. I mean, doctors are not going to want to put in 8 years of school, and then for others that have the internship and then the residency when they want to specialize, they've got several years after that. So you have 12 years perhaps of schooling plus your residency simply to become specialized. And then you've got all these bills that you have to pay. And then you're working long hours. You're on call. You're called in on the weekends. When it's a Labor Day weekend, you may have to be called in for surgery or some other kind of thing. They're not going to go through that if it becomes so burdensome. They're not going to make that kind of sacrifice. Well, you say, well, healthcare is expensive. It is. And there's a way that we can actually, I think, tackle this, that Obamacare is not about bringing down healthcare costs. It's about government takeover of the healthcare system and redistribution of wealth and micromanaging our individual decisions.
In fact, Matt, it's the worst of both worlds. You see, there are two ways that we could handle this. In the private market, if you need more specialization that costs more for the doctor to provide and to get the education, the prices go up. So you wind up paying more for health care. We don't like that. Nobody likes that. If you spread it out, you can lower the quality of the health care because people begin to pull out. Obamacare brilliantly does both of those things. It's causing people to pull out at the same exact time that, as Kathleen Sebelius recently recognized, it causes insurance prices, medical prices to go up.
Yeah, and at the same time, people are pulling out, and healthcare providers and hospitals are actually some of them laying off, like Orlando Regional Medical Center. They're going to open up the floodgates in 2014 and bring in more people through the Medicaid system, already a system that's broken and bankrupt. They're going to put more people on that roll. And more doctors have abandoned Medicaid and Medicare because of the bureaucracy and the low payments that they receive. They get $5 per visit or $10 per visit, and it's just simply not worth all the paperwork that they have to do later on. So this is a nightmare. It's a train wreck coming. Liberty Counsel has the case Liberty University versus Geithner. It's a case that we filed on the very first day that Obamacare was signed into law. I argued at the district court, the Court of Appeals. It went to the U.S. Supreme Court. Now it's back at the Court of Appeals, and I argue it again. And we are challenging the entirety of the employer mandate. We're also challenging the employer mandate as it relates to religious employers because of the forced funding of contraception and abortion. We also challenge the individual mandate because it requires individuals to also pay a fee for abortion when you're part of a plan that covers abortion. And then finally, we are challenging the origination clause because Obamacare originated in the Senate, not the House. And if it's a tax, then taxes have to originate in the House not the Senate. That's what the Constitution requires, and this one went the opposite way. Pray for Liberty Counsel's case. Pray for the argument that I'll present. We are asking people to sign up to pray for this case, and we have nearly 100,000 people that have committed to pray for this Obamacare decision and the argument. Go to Liberty Counsel's website, lc.org. Ask for the book, Take Back America, and also sign up for the Liberty Alert email and the Liberator newsletter right there at the website, lc.org.
You have been listening to Faith and Freedom with Liberty Counsel. We hope that we have motivated you to stand up for your faith, family, and freedom. We can accomplish a lot when we work together. Get informed and get involved today. Sign up for our free monthly newsletter, The Liberator. We will send it out to you free of charge. Stay informed with our Liberty Alert email updates. Just click on the website at www.lc.org or call us at 1-800-671-1776. Tune in next time to learn more about your rights right here on Faith and Freedom.